Assalamu alaikum. I Dr. Muhammad Akram, Department of Eastern Medicine, Government College, University of Islamabad. Clinical notes are vitamin D deficiency. Deficiency of vitamin D causes two distinct medical conditions: rickets in children and osteomalacia in adults. Rickets. It is vitamin D deficiency in growing children and is characterized by continued formation of the collagen matrix and of bone, but incomplete mineralizations resulting in soft, pliable bones. Rickets can be nutrition or renal. Nutrition rickets. It is due to the deficiency of vitamin D and calcium in diet and inadequate exposure to sunlight. Decrease 125 dihydroxycholecalciferol, decreases absorptions of calcium from intestine, decrease plasma calcium level, increase parathyroid secretions, increase mobilization of calcium from bones. Renal rickets occurs in chronic renal failure in which kidneys are unable to form the active form of vitamin D. Exogenous replacement with 125 dihydroxycholecalciferol is an effective therapy. Signs and symptoms. Rickety bones has less inorganic matter, which is the primary defect in uh, rickets. Cartilage cells at the end of the long bones continues to proliferate. Osteoblastic activity is increased as shown by the increased level of alkaline phosphatase. Epiphyseal line becomes widened both laterally and in depth so that nodules develop at costochondral junctions, rickety rosary, and at wrists, ankle, and knees. Tibia bends forward, bow legs, femur outwards, and spine shows kyphosis and scoliosis. A transverse groove appears corresponding with the insertions of diaphragm on either side of the thorax horizon sulcus. Sternum protrudes forward, pigeon chest. It is the most dangerous deformity because it interferes with the pulmonary ventilation. The frontal and parietal bones protrude forward, bursting off head. Skull becomes craniotapes, softening of skull with widening of sutures and fontanelles, delayed closure of fontanelles, retarded eruptions of teeth. There is delay in dentitions. There may be defective enamel productions which predisposes to tooth to decay or caries. Child has poor abnormal abdominal musculature and develop pot belly, signs of debility. Lab diagnosis. Plasma calcium level is decreased initially but is later raised due to increased activity of parathyroid hormone. Serum alkaline phosphatase is increased. This finding is of help in diagnosis. Thank you very much.